I will go ahead and turn this over to Loveless Chief Medical Officer, Dr. Vesta Sandoval.
Thank you very much for allowing us to come and speak with you. We have a very important message today to get out to the public. That message is that vaccines are safe, they're effective, and we can prevent an increased number of deaths from COVID-19. There is still time. People can still get vaccinated. I would encourage everybody that is not vaccinated to go out and talk with their primary care doctor or find a location that can give you the shot. These shots still are saving people's lives. People are not getting severe disease. They're not being hospitalized if they're vaccinated. We really don't want to have further surging, increased numbers of patients in our hospitals. We have many, many very sick, high acuity patients already in the hospitals. We need to avoid another surge. So please, I encourage you again, continue to social distance, wear your mask, wash your hands, but most of all, find a location to get vaccinated. Encourage everybody around you to be vaccinated so that we can be safe and protect ourselves, our families, our communities. Thank you.
Thank you, Dr. Sandoval. Also, I forgot to mention this is being recorded, so if you need a copy of this, please let me know and we'll get that to you. It's also being streamed on our Facebook page as well, which is UNM Health Sciences. Next, we'll go to UNM Hospital Chief Quality and Safety Officer, Dr. Rohini McKee.
Good morning, everyone. I hope you can hear me okay. Thank you for the opportunity to be with you today. At UNM Hospital, we are seeing increasing number of COVID-19 patients, and we have been catching up with deferred care, with trauma care, and with stroke care, and our hospital has been very full for several months. This time around, we are not starting at a place where we have a lot of capacity, but we are also starting at a place where we have a very effective weapon against this virus. I think it is important for people to realize that less than 0.01% of fully vaccinated people have been hospitalized this time around. And so please make sure you are going to an accurate source for your information, and that is usually your primary care physician, to get the facts on the vaccines. Millions of people have received vaccines. They are safe, they are effective, and we would strongly encourage you to go do that so that we don't cycle through this again. Every patient with COVID-19 that is in the hospital is taking up the spot of another patient with a cancer or a stroke or some other illness that needs care. So we would encourage you to do that and to keep our community safe, keep our children safe, and keep the most vulnerable amongst us protected. Thank you.
Thank you, Dr. McKee. Next, we'll go to Presbyterian Healthcare Services Medical Director, Dr. Denise Gonzalez.
Good morning, and thank you everybody for the invitation to present today. I truly wish we weren't meeting this way, because this is an indication that we're back in another surge. Evidence shows that COVID-19 is now really a pandemic of the unvaccinated. In New Mexico, 93% of hospitalizations for COVID-19 are in the unvaccinated. In Presbyterian hospitals statewide, we're experiencing a doubling of cases every week. 3 weeks ago, we had about 22 patients. Last week, about 45. And this week, we have nearly 90 patients hospitalized with COVID. With 167 million people fully vaccinated across the country, we know exactly what the vaccine against COVID does. It dramatically reduces deaths and serious illness. As the Delta variant spreads across the country, it's really not too late for you to take action and to do your part to end the pandemic. Please protect yourself and your family and get vaccinated today. And we should all continue doing the things that have been shown to help decrease the spread of all viruses, COVID, influenza, RSV. And those things are social distancing, masking, good hand washing, and very importantly, isolate when you have cold symptoms. Thank you very much.
Thank you, Dr. Gonzalez. And next we'll go to Tricor Reference Laboratories Medical Director of Infectious Disease, Dr. Carissa Culbreath.
Thank you so much for allowing us to be here today. And although we wouldn't want to be here, again, it's important that we get the information out to the public and to the community. Here at Tricor, we are seeing increasing positivity rate for COVID-19. We are also seeing increased number of tests being performed. Right now, it is critical that people who have symptoms are going to be tested so that we can prevent the spread of the virus within the community. Just want to reassure everyone that the tests that are performed at Tricor are able to effectively detect the Delta variant, and there is no cross-reactivity with other viruses that would cause any other false positive results. The tests that we are performing here are highly sensitive, they're highly specific, and they're our best way to know who may have the virus and our best way to know who needs to be isolated until they're no longer infectious to others. So we encourage everyone to continue to vaccinate, but if you are feeling that you have symptoms, please get tested, find a location, get tested, get your results so that you can know how to better protect your community. Thank you.
Thank you, Dr. Culbreath. Next, we'll go ahead and open it up for questions. If you have a question, let me know in the chat and I will call on you. Go ahead and start with John Cardinale at KOAT. Go ahead, John.
Yeah, how's it going today? We're seeing a surge in children getting hospitalized with COVID-19 nationwide. Is this something we're seeing here in New Mexico at any of the respective hospitals?
So over the last few days, UNM Hospital has seen an increase in the number of pediatric patients that we are taking care of. Even though we have heard that children are not as affected by COVID, it is probably useful to keep in mind that 45,000 children have been hospitalized from COVID-19 and 350 have died. And in addition, we do not know why a small group of children will develop an inflammatory response many weeks after this infection. And so if your child is 12 or older and eligible for a vaccine, we would strongly encourage you to go get vaccinated, get them vaccinated, because we are seeing a small increase in our pediatric numbers at UNM Hospital.
Yes, John, and likewise at Presbyterian, we're seeing increased hospitalizations. You have to understand that the population is being selected for. We have a large number of adults and people over the age of 12 who are vaccinated who aren't going to be symptomatic enough to require hospitalization. But we have a very large population of children under the age of 12 who are not yet eligible for vaccine, and they're susceptible. And so we will continue to see them get infected, which is why all of the other countermeasures that we each described earlier about hand washing and isolating, as well as getting yourself vaccinated to protect the young children who are around you.
Thanks, John. Next, we'll go to Julia Goldberg of the Santa Fe Reporter, and after that will be Brittany Costello of KOB. Go ahead, Julia.
Thank you, Mark. Thank you, everybody, for answering some questions. I wondered if you could talk a little bit more about then how you're handling within your institutions. Had you there were COVID units before, have you had to kind of re-implement earlier procedures that you were starting to phase out a little bit? And then Dr. Culbreath, I wondered if you could speak to, I'm actually hearing from folks that they're experiencing delays trying to schedule COVID tests for themselves. And I'm wondering if, in fact, that is sort of happening widespread, that demand. Those are my questions. If they're not clear, I can repeat them and probably not be any more clear, but happy to do that. Thank you.
Dr. Culbreath, would you like to take the testing, and then the three of us can take the measures in hospitals?
Sure, that's fine, thanks. So regarding testing right now at TriCore specifically, our turnaround times are under 24 hours for receiving test results. But what we have seen across the state is that testing has really become decentralized. So we have many different service providers who are providing tests. People are able to get tests through different retail venues and different private laboratory testing services. And so based on the location where individuals are getting testing, they may start to see delays if there are national increases in testing that are impacting those. But at TriCore, for the local testing that we're performing, our results are provided within 24 hours.
And Julia, with regards to COVID measures in the hospitals, each of the delivery system hospitals has a slightly different setup, but they all achieve the same goal, which is to have a safe environment in our hospitals. For Presbyterian, over the last 15 months, we did learn quite a bit, and we were able to put things in place that are permanent. So we haven't had the need to open up COVID units. COVID units were necessary initially because we didn't have air handling systems in place to have entire units be in negative airflow. And now we've put those types of things in place. And so we don't need to do COVID units anymore for our hospital. But like I said, every hospital is going to have a slightly different setup.
And Julia, I think that it's important to understand many of these measures that were put in place, as Dr. Gonzalez was saying, became permanent measures. There are things that we are always doing to keep our patients and our visitors safe. You know, many of the screening types of exams as people are coming in, for instance, is a good example. Now, some of our policies we have had to put back in place, like limitations on visitors, for example, just simply because we want to start reducing some of the traffic as we see the positivity rates and the numbers of positives within the community increasing. And then again, this is a safety measure to try and make certain that our patients are staying as safe as possible within the hospital environment itself. So it is something that as time, as we see more cases and as the cases increase, it will be a continually changing process. We have learned a lot. We do know how to deal with the situation within the hospitals much better than we ever have before, but it will be something that will be continually changing.
So at UNM Hospital, as of August 9th, we have gone back to more restrictive visitor policies, where we're allowing only one visitor per hospitalized adult inpatient, and have gone back to some of the policies we had in place in February of this year. We require masks for everyone that enters our facility. That has not changed. We require testing for all surgical patients. We're looking to go back to testing for certain other kinds of outpatient procedures as well. And so I think while we have a tremendous amount of experience and we know how to keep our staff and our patients safe, we are also in a climate where we are dealing with an entirely different virus in terms of its transmissibility, and also a slightly altered population because 70% of us are vaccinated. And so it is important not to simply extrapolate what we did last time, but keep in mind that we're dealing with a slightly different set of ground rules, if you will, this time around. Thank you.
And Julia, what you should be hearing from all three of us is that we're very closely aligned. We all have processes and procedures that may be slightly different based on each of our facilities, but we're all aligning to the same goals, which is to have good standards in place that ensure the safety of all of our patients and our staff.
Thank you, Julia. Next, we'll go to Brittany Costello at KOB, and after Brittany will be Matthew Reichb at New Mexico Political Report. Go ahead, Brittany.
Hi, thank you so much for your time. A few things. Dr. Colbreth, I wanted to clarify something that you said. Are you guys actually testing for the Delta variant? I know before it's just been a sample size. So I'm just curious if you could touch on that a little bit. And then I wanted to know if you guys foresee having to ask patients to postpone elective procedures. Again, I believe we did that last time. And then I wanted to ask a little bit more about the kids who are being hospitalized with COVID. I know, we mentioned this is a group that, wasn't getting it as often, but I wonder if anyone could touch on what you guys are seeing in those hospitalizations with kids. Are they, how long they're staying in the hospital, how serious the conditions are, and if the symptoms are similar to that of adults who are also hospitalized. Thank you so much.
Thank you so much, Brittany, for that question. So to clarify, our test will be able to detect if somebody is infected with the Delta variant, but we're not specifically reporting out that someone has the Delta variant or not. We're collaborating with the University of New Mexico researchers as well as the state laboratory to be able to send samples for specific sequencing for the variant. I hope that clarifies your question.
It does. Thank you.
Thank you.
And Brittany, with regards to what we sometimes call surgical gating, or prioritizing which surgeries should continue to be done versus those which can be deferred. We are working at the level of the medical advisory team that's now meeting once a week to discuss this and to anticipate so that we can plan for it rather than waiting for some sort of mandate to occur. That way we can self-titrate so that we can maintain sufficient hospital resources available to admit more patients who need admission, but we also don't want to defer too many quote elective cases because then some of those elective cases turn into urgent cases, which is not something that we want for our patients. You heard my colleagues mention earlier that we're starting off at very high hospital occupancy levels, and that's because we're trying to address all of the care that's been deferred over the last 15 months. That's what's really driving our not wanting to impose even further delays in this type of surgical care.
Thanks, Brittany. Next, we'll go ahead to Matthew Reichb of New Mexico Political Report. After Matthew will be Sean P. Thomas of the Santa Fe New Mexican. Go ahead, Matthew. Matthew, I think you're still on mute. All right, Matthew, we'll come back to you. We'll go to Sean P. Thomas of the Santa Fe New Mexican.
Hey, can you guys hear me? Okay, perfect. I usually have trouble with these things. But my question is, we have here in Santa Fe, we have the Indian market and other, large events that have either passed or are coming up in the future. Is there any concern that those events might turn into super spreader events or sorry, lost the other term, but yes, might turn into super spreader events moving forward. And then I had another question, which is, I know you guys are mentioning kind of exponential growth in the amount of COVID cases that you guys have been receiving. If our vaccine numbers don't change, do you guys have any modeling or any numbers of what it might look, say, in October or November or December, once some of these larger holidays start popping up?
Sean, I'll take the modeling question. It's something that came up at the MAT meeting last week, and we're pending receipt of that modeling information. I know that it's being worked on.
So if I might answer Brittany's question, if that's okay, because we did miss the question on the pediatric cases, I apologize. So we are seeing a rise in pediatric cases, but the absolute numbers are still small. What we're seeing so far are similar symptoms to that seen in adults. And because we have small numbers, I think that is about the extent that I can speak and keep things general without going into specifics, because again, it's a small number of patients. We haven't had these patients in the hospital for too long at this time. So I can't comment on length of stay just yet. With regard to Sean's question, there are many things we know about this virus that can help us to stay safe. We know that outdoor events in general have a much lower risk than indoor events. We know that masking and social distancing work. And if we can get our vaccination numbers up, it is important for people to understand that we can get back to all those social events that we hold so dear, especially in the fall here in New Mexico. It is important to wait for the modeling because the virus has changed, because our population characteristics have changed in terms of our immunity. But there is still time for us to push our vaccination rates up so we can enjoy the Indian market, we can enjoy Balloon Fiesta, and all these fall events that we hold so dear here in New Mexico. Thank you.
Thank you.
Thanks, Sean. Next, we'll go back to Matthew Reichb at the New Mexico Political Report. And then after that will be Ryan Boetel at the Albuquerque Journal.
Hi, thank you. Sorry about the technical difficulties. Does the fact that we're having this surge right now show that there needs to be a change in the public's actions since July when things opened back up?
I'll take the easy answer. Yes, get vaccinated. That's the biggest action that people have to take right now.
And again, I think it's just important to realize that we do know what works. We do know that, by wearing masks and washing hands, staying out of crowds, we can mitigate the spread of these viruses, whether it's COVID or influenza or whatever it may be. It's very important that moving forward that we continue to work towards getting as many people vaccinated, including children, as much as possible, just so that we can, as Dr. McKee was saying, get back to where we want to be, being able to be out and socialize and be in groups. We need to place this very safe and be careful and take care of each other in our community by going and seeking the vaccine.
If I might add to that, I think it is entirely understandable that when summer was here and people were tired of being cooped up in their houses for 15 months, that they went out and did the things that we enjoyed doing during the summer months. I think what this latest surge has shown us, that is, if you're not vaccinated and if you allow the virus to spread, it will mutate. And if we continue to stay unvaccinated, we are faced with the possibility of an even more dangerous mutant in the future. So the longer we stay unvaccinated, the more opportunity we are giving the virus to mutate again. And we already know that there are other mutants on the horizon that we have started to study. And so while it is completely understandable that the people of New Mexico went out and enjoyed their summer as they should, I think the other side of that coin is that we need more people to get vaccinated so that we don't develop more deadly strains that put us right back to where we were in last winter. Thank you.
Thanks, Matthew. Next, we'll go to Ryan Boetel of the Albuquerque Journal. After Ryan is Susan Montoya Bryan of the Associated Press. Go ahead, Ryan.
Thank you. Thanks, doctors, for taking our questions today. Dr. Gonzalez, you talked earlier about how hospital bed spaces are filling up and that it's not all being driven by COVID. I was wondering just, and if anybody wants to jump in, can you quantify in any way what hospital space, hospital capacity is like in the Albuquerque metro area right now, and what are all the different drivers for that? And in addition, another question I had was, I was curious if the demographics of the typical COVID patient have changed this time around compared to earlier in the pandemic in terms of like either age or ethnicity of the typical COVID patients. Thank you much.
Thanks, Ryan, for the question. I'll try to address as many of the parts of your very long question as I can remember. So first on hospital capacity in central New Mexico, nearly all of us in central are full, both for ICU and non-ICU beds. There's very little additional capacity. But as Dr. McKee mentioned earlier, we started off the summer with low COVID case counts and very high hospital occupancy. So we had very little capacity to add as COVID cases have gone up. So even though the COVID cases are growing exponentially, we started off in a different place, as Dr. Sandoval said earlier. We started off with full hospitals, and then you add on a surge. And I can't remember all the rest of the questions that you had.
Oh yeah, I was curious if the demographics of the typical COVID patient have changed now, just especially since it's sort of, as you said, a pandemic of the unvaccinated. Does that change kind of the typical patient?
Yeah, that's a very smart question, and hopefully it makes our point. When we first started seeing patients 15 months ago, there was a spread, but it tended to be people with underlying medical conditions just because it was harder for them to compensate for reacting to the infection itself. And so a little bit older, a little bit sicker with chronic conditions. And now what we're seeing is that it's the people who aren't getting vaccinated. And so that demographic tends to be younger people, not necessarily with medical problems, because maybe there's a sense that they're invincible and that COVID won't get them because it didn't get them already. So when you see that 97% of the hospitalizations are amongst the unvaccinated, it's the unvaccinated demographic that constitutes all of our hospitalizations. And those tend to be younger people.
And I'd just like to emphasize again what Dr. Gonzalez is saying. We're seeing people in their 20s, 30s, 40s, 50s. We're seeing people who do not have chronic underlying immunocompromising diseases. They're people who are relatively healthy, who are not vaccinated, who've been exposed, and then are developing severe disease. So, if you are in that age group and you're not vaccinated, you're not going to be safe until you get your shot.
And we are seeing younger patients with better health at baseline who are hospitalized, and well over 90% of our hospitalized patients are not vaccinated.
Thanks, Ryan. Next, we'll go to Susan Montoya Bryan of the Associated Press. And after Susan, we'll go back to John Cardinale of KOAT. Go ahead, Susan.
Yes, thank you, doctors, for taking our questions today. And Ryan actually stole my question there on demographics. But what I'm wondering is, do you have any percentages of the folks who are in the hospital now unvaccinated that do have pre-existing conditions, or if you could give us, quantify that for us? And then also, any of those folks have breakthrough cases that you guys are seeing now? Thank you.
Susan, I can answer the breakthrough case question. The rate of breakthroughs is exceedingly low. Dr. McKee mentioned earlier the national statistic on that, which is like less than 0.001% of vaccinated patients requiring hospitalization. Here in New Mexico, it's only constituting about 7% of the hospitalizations are amongst the vaccinated. There's a couple of ways to talk about breakthrough cases. So for us as physicians, the importance is you got sick enough with your breakthrough case to require hospitalization and/or you experience death. There will be some people who get symptoms, just like when you get the flu vaccine. Some people do get symptoms, but what I tell my patients is, but you didn't land yourself in the hospital and certainly you didn't die. So the vaccine is extremely important because it achieves what we want it to achieve. And that's, you don't get hospitalized and you don't die. You may still have some symptoms though, and that's okay. It's better than the alternative.
At UNM Hospital, we have seen just a handful of patients who have been vaccinated who have landed up in the hospital. They are not in our intensive care unit. But it is a 25-fold decrease in hospitalization and a 25-fold decrease in deaths if you have received the vaccine. And so no vaccine is 100% effective, and we know that from all the vaccines that we have been used to all these years, and this is no different, but it does keep you out of the hospital and it keeps you alive, and we have overwhelming evidence to prove that.
And we should also remember that even for the vaccinated, if they are symptomatic, that it's still important to get tested because it could be possible to transmit the virus to those among us that may not yet be vaccinated, either because they're not eligible based on their age or they just haven't made the decision yet. So for anybody who is experiencing symptoms, even if you are vaccinated, it's important to be tested so that you can do the appropriate safety protocols if you are positive.
Thanks, Susan. Next, we'll go back to John Cardinale of KOAT, and after John will be Sean P. Thomas of Santa Fe, New Mexican. Go ahead, John.
Yeah, I just want to thank you all again for your time today. I have a clarifying question. I believe Dr. McKee earlier said it was 93% of people that are unvaccinated that we're seeing in the hospital. And then another question I have is how many of these hospitalized patients are from out of state? Are we seeing that as well? Thank you very much.
I believe that number came from Dr. Gonzalez, so I'll let her speak to that. John, I will tell you that we have seen a few patients, less than 10, who are from out of state. They're either visiting, they're traveling through, and the common underlying characteristic of all of them is that they're not vaccinated. So it is not a significant number, but we have seen a handful of patients from other states at UNM Hospital.
Yeah, that was me who talked about 93% of patients across the state are unvaccinated who require hospitalization. I wanted to comment from the perspective of the hub and spoke team that meets across the state once a week now, that Dr. Sandoval joins me on, that we have seen an influx of out-of-state transfers, in particular to our eastern border hospitals, as well as along the south. So Roswell, Clovis, and Las Cruces have been hit with a lot of out-of-state transfers as far away as Houston and Oklahoma. And I think that on our call this week, and maybe Dr. Sandoval can elucidate some more, we've been getting, even in central New Mexico, transfers from out of state, and they're pretty universally unvaccinated from not New Mexico.
I can follow up to what Dr. Gonzalez is saying in that when we look at hospitals across Texas, Oklahoma, Louisiana, Kansas, Arizona, all of those states are struggling to place patients in hospital beds. And if you look at those states, many of those states have far more hospitals, many more ICU beds, many more providers than we do here in New Mexico. And so I think the important point here is, again, we in New Mexico want to avoid that situation. We don't want to be searching for beds. We want to be able to take care of anyone who has a need, whether they're having an MI or a stroke, whatever that might be. We want to have a bed for New Mexicans. The way we can do that, and I know we've said this before, but vaccination is how we can try and keep the hospitals from being overrun. Because if you look at all the states that I named, many of those states have low vaccination rates and they are struggling.
Thanks, Dr. Sandoval. I think it's important also that the media understand and relate to New Mexicans that New Mexico is unique in the country in that we have come together and we're collaborating along with the Department of Health and the Secretary of Health. We're not going it alone. You hear us on these press conferences once a week, and we're aligned because we understand that there's so much strength in collaboration and in helping each other out. We are here to serve New Mexico.
Thanks, John. Next, we'll go back to Sean P. Thomas of the Santa Fe New Mexican. After Sean will be Brittany Costello of KOB. Go ahead, Sean.
Thank you, and thanks for making the time for another question. I just had a quick clarifying question. Do we have a sense of how many individuals are coming in partially vaccinated who are being hospitalized?
Sean, I'm sorry, we don't have access to that data, but we can certainly refer it to the Department of Health.
Thank you.
We don't have access to that either. We do look at fully vaccinated individuals with the usual parameters of 2 weeks after the last dose of Moderna, Pfizer, etc., but we don't have that information, sorry.
Thanks, Sean. Next, we'll go to Brittany Costello of KOB, and after Brittany will be Julia Goldberg of the Santa Fe Reporter. Go ahead, Brittany.
Hi, thank you. Just following up on that, and I have just a couple questions, but so when you guys get someone who's hospitalized, how do you check vaccination status 2 weeks out? Do you check their vaccination card? Is it verbal? How do you guys, identify the people who are fully vaccinated versus not? My other question, I know we had a little bit of trouble last time with staffing, and you kind of alluded to it just now. I'm wondering, do we have the staff to care for another surge in terms of nursing people at these hospitals? And what was my other question? And then my other question was, we're coming up on flu season, RSV season, and so I'm just wondering, what are you guys kind of predicting as we move forward with obviously an increase in cases, and we're going into a season where you guys are already pretty busy? Thank you.
So Brittany, with regards to testing, before we send the tests over to Dr. Culbreth and TriCore to run, we do answer a series of questions that are a questionnaire that's connected to the order. So we do ask patients, and then we're able to later reconcile that with the Department of Health on their vaccination record. We confirm on the back end, but on the front end, we start off with a questionnaire, and it's just a verbal thing that they do. I'll defer for the others to answer it because this is another multi-part one, and I've already forgotten the other parts. So Dr. Sandoval is going to help me.
I think that as far as flu season and RSV season, we have seen some increasing cases of RSV already in certain parts of the country. And it's important to remember, as was mentioned earlier by Dr. Gonzalez, if you're wearing a mask, washing your hands, taking all the precautions that we've talked about earlier, those things also help with, the flu spread or with RSV spread. And we do have the flu shot, which is also exceptionally important for people to receive this year, because again, the last thing that we want to see is a large number of flu cases on top of COVID and already very high acuity patients within the facilities. So getting a flu shot is also going to be very important in order to help us going into the fall season.
At UNM Hospital, we recently have seen increase in number of pediatric RSV cases. Our pediatric urgent care has been very busy. We know from last winter that masking and appropriate social distancing causes those cases to plummet. So we know that this works to decrease the number of flu cases and RSV cases as well. And we do have to balance that out with the social needs of our children. But we do know what works against this. With regard to staffing, which I think was the other part of your question, our staff, first and foremost, I'd like New Mexico to know that our healthcare workers are tired. The high census that we've had over these last few months has led to hiring of traveling nurses, and with the nurses being very, very busy. And so if you are grateful to healthcare workers, please go get vaccinated. That's our message to you. But at UNM Hospital, we have hired traveling nurses and we have made adjustments where we can safely with our staffing ratios to take care of the increased load of patients that we've had over the last few months.
I think Dr. Sandoval made a great point earlier when she was talking about how we're reacting now, but starting off at a point where everybody's very full and very busy. There's much less availability right now for any of us to hire more staff. There's just not the same availability of traveler nurses. So we're all going to have to just pull together and figure out other ways to take care of New Mexicans. As Dr. McKee mentioned, changing the way that we staff, whether it's with staffing ratios or other processes. These are all things that we're working together on.
Thank you.
Thanks, Brittany. Next, we'll go to Julia Goldberg, a Santa Fe reporter, and after Julia will be rboetel of the Albuquerque Journal. Go ahead, Julia.
Thanks, Mark. I was just curious, and this probably just reflects my not understanding the situation very well, but when you have unvaccinated people that are ending up hospitalized, is there space in there for, is the hospital getting involved then at that point in conversations with those patients or with family members to try to encourage vaccination upon recovery or vaccination for family or people who are close to them who have also not been vaccinated? Is that something that happens in these situations, or is it just much of an acute situation for that? And Dr. Culbreth, when you have just a quick second after that, I get your weekly infectious disease reports, which I really enjoy. I thought they said somewhere that that the COVID tests also screen for flu in some cases, but now I can't put my finger on where I saw that, so I was curious if that was true. Thanks so much again, everyone.
Julia, I'm going to share my personal experience because I'm a pulmonary critical care physician. So when I do see patients who are unvaccinated and they're ill with COVID, I do take some time when it's appropriate to have a discussion about the importance of vaccination for the patient as well as the rest of the family members. It's something that's important. It's something that I'm passionate about. And I think each of us as individuals caring for these patients have to find the right way to connect with them.
And in our system, we've started trying to have those conversations in the emergency room or on discharge from the hospital. So not just patients that have had COVID, but other patients that are in the facility for other reasons, to try and have those conversations about why vaccination is important and offer the shot on discharge so that they have the opportunity to take the shot before they leave.
And at UNM Hospital, we use every opportunity we can to talk to the patients and their family members in a respectful manner about the importance of vaccinations. One of the myths that we try to dispel is that having had the COVID infection confers the same immunity. It does not. We have very good studies now that pretty conclusively tell us that your immunity, especially to different kinds of variants, is much better with the vaccine than with the COVID infection. And it is strongly recommended that you receive a vaccination even if you've had COVID-19.
Thank you so much.
So Julia, regarding the testing, what we offer at TriCore are two different types of tests. One is a test for COVID by itself. And then we offer another type of test that we call a multiplex type of test. A multiplex test looks for a variety of different viruses and can detect them individually. So somebody who has symptoms of COVID, those symptoms may overlap with things like the common cold or influenza or RSV. And so what the multiplex test does is it allows us to test for many different viruses from the same sample so that the patient doesn't have to be collected multiple times to be able to get those answers. And so that's probably what you saw, is that there are cases where we will test the same sample for COVID, we'll test for flu, for RSV, for many other viruses. We report those out separately, so there's no cross-reactivity within the sample, and the numbers are all separate. And so that's how we're able to provide those type of results, especially as we approach flu season. That's going to be very important.
Got it. Thank you so much.
And Julia, TriCore really is a cutting edge lab. You could put them up against any other lab across the country. I think we take them for granted because they're here with us. But we've been doing these multiplex tests for viruses for many, many years now. And it was really extraordinary how quickly TriCore ramped up and added in the COVID testing for COVID-19 initially, and how much they've ramped up their operations to be able to take care of very high volume testing.
Thanks, Julia. And let's go to rboetel of the Albuquerque Journal.
Thank you. Julia actually asked the same question that I had about education of unvaccinated patients. I guess a follow-up would be, can you give a COVID vaccine to a person who has COVID? And if you can, why not just make that like part of the standard treatment plan for unvaccinated patients? Thank you. Hi, did you hear me?
So I'll be happy to tackle that, Ryan. So first of all, the vaccine is not mandatory, right? And so it's always a conversation with the patient, and the patient has to agree to take the vaccine. Depending on the clinical situation, because as you know, there is a vast spectrum of presentation of COVID-19. You could present with a cold, or you could present in respiratory failure in the intensive care unit. So it is safe for people who have gotten over the infection to receive the vaccine. There is no set amount of time because it depends on the clinical situation. And we certainly have those conversations with patients, but we cannot assume consent. But we do our best to vaccinate these patients either at the end of their hospitalization or electively as an outpatient. But we cannot make it part of our protocol, obviously without patient consent.
Thanks, Ryan. Seeing no more questions, we'll go ahead and bring today's media availability to a close. Thanks again, everybody, for joining us. Once again, this was recorded. If you need a copy of it, please let me know. We'll get that to you, or it's also available on our Facebook page, which is UNM Health Sciences. Thanks again, everyone.